The National Alliance on Mental Illness is a national organization, and it definitely tries to get the message out to the community that these things can get better. What we know is that these problems are brain disorders, and they can and should be treated. They can be managed quite effectively if a person has access to, notice the word, a combination of medication, supportive counseling, and community support services, including education. That's a pretty expensive prescription. Many people have medicines. Often people don't have supportive education. Many people have good counseling in their church, but they don't have the money for medication. And they don't have everybody working on the same page. This is what it takes. And to bring that about, the community has to change. Who gets mental illness? You know, my sister has a daughter who has MS. Oh boy, that is a terribly disabling disorder. Hopefully, even though we've got a neurological system, we all do, we won't get MS. The prevalence of MS is just a small population, but it's devastating when you get it. It's very sad. But mental illnesses are more common than cancer, diabetes, heart disease, or AIDS. And what we know today is you can get them at any age. Years ago, we didn't think children could get mental illnesses. When my husband and I took our foster parent training, we took a MAP class, and then, we took a NOVA class first, and 10 years later we took the MAP class. And I don't remember anybody telling me that mental illnesses are brain disorders, and that when a parent has them, they're prone to drug abuse, and when they have children without any support around them, those children are likely to have bipolar disorder. I don't remember anybody telling me that. I don't think anybody did. I really don't think most people know that. 20 to 25% of individuals may be affected by mental illness. This prevalence is really high. Basically, if you have a brain, you need to learn about how to take care of it, and you need to learn about mental illness. That's how I see it, and my husband agrees with me. We've had children in the public school system, in the best school system, I think, in the city, and they didn't get it. I'll tell you a little bit about that in a minute. I love this slide because it kind of brings out in all of us the tendency to think that we can know by looking at somebody. If I was in that older people's group down there, I'd be pointing my finger at that guy with the pointy hair there and saying, yeah, I think he's the one, or the one that's kind of slouchy, We all tend to think somebody else has got it. Those kids, I can imagine those kids would look down there and say, boy, that family's really ill. The pictures are dated, okay, that's why it's funny. But the bottom line is, people with mental illnesses are our family members. And I've got people in my family that look like in both those pictures too. They are our family members. They're our friends. Chances are, with a prevalence rate of 1 in 4, if you're standing with a group of 5 people talking, somebody there is probably taking medicine or should. Because that's how amazing, you think about a lifetime prevalence rate, 1 in 4. Now, by the way, the numbers I gave you when I started and the numbers I'm giving you now all come from the National Institute of Mental Health. So our information with NAMI is always reliable. Our programs are always evidence-based. What we also know is that 7.5 million children are affected by mental, developmental, or behavioral disorders. 7.5 million kids. Remember last year when we were so worried about that H1N1 flu? Remember how scary that was? And because we were supposed to have a high rate of people getting this terribly deadly flu, people kept their kids out of school because they were afraid they would catch it. The prevalence of mental illness is way, way beyond what we even thought the flu problem would be at its worst. But nobody seems to be concerned. it doesn't seem like anybody is asking for more information about mental illness. 2/3 of all people with a diagnosable problem don't seek treatment. With proper treatment, though, many people with mental illness, of all things, can return to normal lives. One place I feel mental health information would be important to get to is in everybody's EAP programs. How many people do you know who have to take time off school to visit their kid in the hospital, to deal with their kid with law enforcement because their child is out of control and they don't know what to do, and they look for treatment for the kid, but there's nothing to support the family? And EAP programs would do well to do what they can to support the NAMI in the community. Mental illnesses can and should be treated. Mental illness can and should be treated. NAMI is the nation's largest grassroots mental health organization dedicated to improving the lives of persons living with serious mental illness and their families. It is an organization of family members, dedicated family members. At NAMI, we are a group of volunteers, and we work a lot. We do things like this. I'm not a paid employee of NAMI. I just volunteer my time to come and tell my community about these resources. And pretty much we pay one person in the office, and that's about it. The rest of us work really hard and volunteer our time to give you our stories and let you know what's available out there. And we have a shared mission. We want to support, educate, and advocate for people with these kinds of problems. We educate the public. We have family and consumer peer education and support activities. We advocate on behalf of people living with these problems. And we have visible public events that raise support. This is a public event. We also have our walk that raises funds for these kinds of things. We have a week that is the first week in October. It will begin on our Mental Illness Awareness Week is what it's called. In 1990, Congress set that week aside for communities to help themselves be more aware of the needs to support people with mental illness. Who we are. We are a 501c3, by the way. Our vision is to ensure that people are accepted, people with mental illness are accepted and receive treatment and can have their recovery facilitated. We are advocates. We promote change, we offer education and information, we create the possibility to a higher quality of life. We promote change by providing science-based information, and I think that's one of the very important things. Severe mental illnesses we know are brain disorders that can be treated and managed. I was a new nurse in 1970, and we had on our unit in the hospital I worked at a stroke rehab unit. And back then, families didn't understand about the brain, and a family member would have a stroke and they couldn't talk anymore, so off they go to the nursing home to be the same way 10 years later if they lived that long. We began to teach families about the fact that a stroke is a damaged area of the brain. A person can rehabilitate back from that. Just because he can't talk to you doesn't mean he doesn't know exactly what you're saying. These are all pretty basic concepts that we all kind of understand when it comes to brain issues. People did not always understand that. Did that hop ahead? No. Okay. People didn't always understand that. We know that people with a brain tumor can have a damaged area of the brain, and it's going to result in some changes in behavior. What we now know, though, is our brains are made up of all these little neurons, and they pass messages. They don't touch each other. Those synapses, that synapse is actually a gap. And what makes that message pass are the chemicals in between there. And we know now, and our medications are so specific for those particular nerve endings that we are very successful, truly, at changing and improving a person within 2 or 3 days after they start the medicine. Now, granted, it takes a month or 2, but really, you can see a difference within the first few days, and sometimes that's why hospital stays are so short because truly a person is not displaying the tendencies they were when they first came in. What that tells us is the medicine works. They just need to stay on that medicine, and that's the tricky part. When they come out of the hospital and families get a mixed message between the doctor and the school, then they really begin to think, I don't need to spend $300 of my money every month on my child's medicines, and the parents don't help the kids stay in treatment. We want people to know that this is scientifically based. This is our national website. And if you are a counselor, if you're a nurse, if you're dealing with people in the community at all, you need to take down this website, and at your leisure, go to it. It's www.nami.org. You don't need a password or anything like that. This is available to everybody. What you'll see when this comes up here is mental illnesses. You click on that, and you pull down a menu that lists the name of all kinds of disorders. You click on each one of those disorders, and you're going to get an array of information about that disorder, written in a way that you and your families kids can understand. We provide education. Education is informing the public, informing our employers, informing our policymakers that a higher value should be placed on recovery and the quality of life that a person with severe mental illness has. If we do that, he can achieve a much higher quality of life. Education services for NAMI are just a very essential part of understanding and coping with mental illness. We provide numerous educational curricula, workshops, and all kinds of opportunities for people to learn. And I want you to know our information is all free. We don't ever charge a family to come to any of our classes. We don't do that. If an organization believes that what we have to offer is valuable, then we might contract with that organization, as we have some of the community organizations in the past, to provide some services, and that contract money that's given to us pays for the printing of materials and those kind of things. Our manuals that our families come away with are usually about this thick, cost to make about $50. We never charge that family for that. One of the things we believe in NAMI is that families go through a cycle. And if you've ever worked in the area of death and dying, you're familiar with that 5 stages of grief from Dr. Kubler-Ross. At NAMI, we talk about something similar, but we don't call it the stages. We call it a cycle. We cycle through a response. Initially, that first stage is dealing with the catastrophic events. We may know that our child's got some problems, but as my son did one day, whenever you get a call from the school and he's knocked a child out of his wheelchair, all of a sudden it's a catastrophe. We don't know what to do as families when we're in the middle of that, and people are coming at us asking us to make decisions. Do something with your child. We don't know what to do. We're completely confused, usually very embarrassed. That next stage is learning to cope, where we're more able to deal with things, and then we can be an advocate. The trouble, though, is the next catastrophe is going to throw us back into stage 1. During that stage 1, what we need is support. We need, as a family, we need comfort. We need somebody to be empathetic with our confusion that we feel. How many things have you seen in the newspaper where someone, because of a mental illness and a rage that they go into, do something terrible, and then they interview the family? Don't you wonder what the heck is going through that family's mind? What was the matter with them? Why didn't they get help? Doesn't that make you wonder? This is why. They're just blown away. They don't know what to do. They need crisis intervention. Actually, what they need is a prognosis. Somebody needs to come to them and tell them, what they can expect. They also need somebody to be empathetic for the pain that they are going through, because this is very painful. So don't ask a parent what they know. Don't expect them to learn anything from what I'm telling you here today when they're at that point. But if you give them the support and comfort they need, they're going to come back to you. They're going to remember that you were the friendly face. And when they are beginning to understand and learning to cope, they're going to come back to you to vent their feelings. But they're also going to need at that point self-care. They're going to be ready for the education at that point. They're going to need some skills trainings. And that's one of the things that our classes teach, are communication skills, the I message, and how that's much more beneficial than the you message. Reflective listening, all of those like motivational interview techniques that many of you know, that's what we're going to help them go through and learn. That last stage is moving into advocacy. Oh my goodness, nothing like an advocating parent in an ARD. I was in one ARD one time with one of our kids, and the special ed coordinator was telling me about this child. Don't worry, he's going to outgrow it. And I said, oh really? How do you know this? Well, that child outgrew the ADHD and went directly into bipolar disorder, and later was vandalizing the school in the middle of the night. So they don't always know, but I knew at that point, and I was really willing to be an advocate. And when they began to try to use language with me to sort of make me not be the advocate I needed to be by calling me honey in the ARTs, I didn't like that either, and I let them know that. But that's where that energy goes. When a person becomes an advocate and they're knowledgeable, look out. NAMI educational programs are as follows. I love this program. This is our NAMI Basics Education. We talk about the fundamentals of caring for your child with these problems. Family to Family is a similar course. It's for people that have adult family members with severe mental illness. We do the same thing, but it's weekly for 12 weeks. It's also free. Great minds think alike. Shelvia, talk to Shelvia about that. This program is very, very good. In Our Own Voice is a wonderful presentation. It is a multimedia presentation by two consumers. They bring a DVD. They play 3 minutes of the DVD talking about the dark days of being ill. And then they stop the DVD and they get up, and they have been able, in taking the training, to formulate their own little story into like 2-minute segments that they intersperse with this DVD. It's really amazing. And the people, the consumers that we have doing this, I mean, if they are very willing to tell their story, but it is very impressive to hear this presentation. We do it for Lions clubs and Rotary groups and things like that to improve people's understanding of people in recovery with mental illness. Peer-to-peer is a class for adults with mental illness that they get together and talk about their illness and how to get well, how to stay well. We have faith-based initiatives. We will take our program. We've got one particular program that we take to churches to help churches become more welcoming to people with mental illness also. We have support groups also for consumers and family members. If you go to our website, this is a NAMI Connection. It's a support group specifically for people with mental illness also. The support group my husband and I lead, we lead it third Thursday from 9 to 11 at Alma Heights Methodist Church. And ours is mainly for family members of someone with a mental illness. NAMI Connections, La Paz was doing this for a while, and I know that there are some other sites in the community that do this, but this is a special one for people with mental illness because they've got their own issues. This is our local website, and if you go to this, there's our homepage. Our education programs will tell you what's happening and what's starting and when. Our local support groups are listed. Our faith-based initiative, we have a calendar of events there.